Consumer-driven healthcare in the U.S. market today is the fastest growing segment of healthcare spend. We as patients today are responsible for just over $300 billion in payments, and that number is growing to $660 billion by the year 2015. So in general, what we see is literally 50% of patient payments go uncollected in the market. It's a big issue for providers.
I've been working at this practice about 21 years, and during that time it's gotten more and more difficult to be able to collect patient payments. And in fact, probably a lot of it has to do with the fact that patients are now responsible for a lot more of the payment than they used to be.
We calculate what the patient will owe at point of service.
The patients really truly appreciate knowing their responsibility up front. So we're not having to over-collect from the patient and then have to issue refunds. We're not having to under-collect from the patient and then have to balance bill them for a small portion.
What our service allows them to do is authorize a bank card. It's only an authorization. We're not actually settling the funds at that point in time.
We didn't really have too much problem explaining this to the patients because they've become familiar with this type of process in the past. They've been at a hotel where they've been asked to hold the hotel room with the credit card, and that the actual charge doesn't come through until everything's been completed. And we've actually received a couple of thank you notes from patients saying, we appreciated knowing what this was going to be, and we appreciate that you're willing to wait until everything has been finalized before you're collecting that.
We're able to, with the Allscripts solution, turn around and bill the patient's debit or credit card on the day that we receive the reimbursement from the insurance company.
Because we've offered this solution, we're able to collect probably about 70–80% of the patient payments up front. Prior to having the solution, it would have been closer to 40–50%.
The results with Allscripts patient payment assurance has been extraordinary. We are seeing providers decrease their accounts receivable for up to 50% in a very short time frame. We're also seeing gradual elimination of bad debt. Implementing Allscripts patient payment assurance is actually quite simple. We don't require a lot of process change. We actually fit inside the current revenue cycle management process in the current processes today that are being done by the front desk staff.
They really worked with us to see what would be best in training our employees and so forth. They were here when we needed. If we had any comments, suggestions, etc., they threw them right in. I think for an Allscripts client, this is a fabulous solution because it is all in one, no dual entry, no problems with any putting it on the wrong patient and so forth. You've got all the information you need at your fingertips, so it's been great.
The financial results have been fantastic. We have realized return on investments for practices that have fully implemented patient payment assurance, anywhere from 5-to-1 return up to a 10-to-1 return.
I think if someone asked me if I could go back to doing it the way that we used to do it versus now, I would have to say I sure wouldn't want to. Our staff has just taken to this so well. They're used to having one solution now for doing pre-authorization, for doing regular payment, for having everything all in one place at their fingertips. I really wouldn't want to have to go back.